I knew that I was going to go into medicine since I was 4 years old. My great-grandmother was diagnosed with Alzheimer's disease at that time, and she actually lived for 19 years after that. So I watched her progress through all of the phases of her disease, and I watched my loved ones kind of go through that process as well. So that's what initially sparked my interest in medicine, but ultimately that interest and desire was solidified when I lost my father to a car accident when I was in college. That initially kind of drove me to a surgical route. I was initially actually thinking trauma surgery, but I did my obstetrics and gynecology rotation during medical school and fell in love and changed my mind. I fell in love with obstetrics and gynecology for several reasons. I think the first thing that really drove me to it was the surgical side of things. Like I mentioned, that's something I feel very passionately about, but ultimately, OBGYN is a very unique field. We are blessed to be able to take care of our patients through all aspects of their life, from when they're young to when they're going through menopause. And you get to help these patients through not only the good times of their life, but also the more struggling aspects as well. I feel like the most classic answer as to what is most rewarding about obstetrics and gynecology is the obstetrics and delivering babies. And that is absolutely rewarding and is a privilege and an honor. But what I find the most rewarding about our field is being able to be there with my patients through those hard times and being the doctor that pulls up a chair and takes the time to sit down and talks with my patients and answers any questions they may have, and talking to their family members or their support group, whether they're in person or on the phone, and just making sure that I feel like I am providing care to them and taking the time to help them through whatever is that most difficult time and ultimately helping them on the process of healing.